First of all, welcome everybody. Thank you for joining me today for this Rural Health Resources class. My name is Sarah Levin-Lederer, and I'm an Outreach and Education Coordinator for the network of the National Library of Medicine Region 7. Today, November 20th, 2025, when this class is being taught and when it is being recorded is Rural Health Day. And so that is why we are going to be digging into these resources and connecting you with this information. Very briefly, I wanted to introduce the network of the National Library of Medicine to you. Many of you have probably already taken classes with us, so you may be familiar, but for those who are joining us for the first time or as a refresher, um, we are an NLM, and as the name suggests, we are the outreach arm of the National Library of Medicine, which is a part of the National Institutes of Health, or NIH. We work regionally, getting to know communities on the ground and keeping those communities, or helping those communities serve the people that know best. I am with Region 7, which serves New England and New York, but wherever you are, there is a region there that serves you as well. We work across the country, as I said, understanding how to use with people to help them access and understand how to use health information. This includes both working with organizations like libraries of all types, schools, healthcare, and all sorts of community-based organizations. And I encourage you all to visit nnlm.gov to learn more. So, before we get into the heart of why we are here this afternoon, I did also want to point out an additional resource. The NNLM Reading Club provides books, recommendations, as well as discussion guides and supporting health information on a wide variety of topics, including one on rural health. These are resources designed to help support communities interested in working on health literacy through reading clubs and book discussion groups. Okay. So with that, before we really get started, so I said before we get started, but before we really get started, I'd like everyone to take a moment to imagine rural. What does it look like where you are? The landscape, the communities, the people. What industries do you think of? And what are the challenges and successes? And I wanted to have you all sort of fix this idea in your mind before we started, because what I think of here in New England may be very different from what you think of. And so we are taking a broad national view. We are looking at some resources that you can sort and look for local information. But some of the things we talk about are really information across the board. And so it may not be specific to what you are thinking of. Okay, with that in mind, we are going to describe current demographic trends in rural America, explore data sets and visualizations for rural health resources, and then do live demos to help locate information on health conditions, demographic groups, and structural challenges. So, as I said, today's class is about rural health. So depending on the definition, around 15 to 20% of people in the United States live in rural areas. There are many different reasons why people live in rural communities. Lower cost of living, a slower pace of life, rural areas are less crowded and can offer more privacy, or you may live in a rural area so that you can be near your family and friends. But there are also challenges. Longer distances for emergency services, there may be limited or long distances to travel for routine screenings, or then even for dentists and other specializations when you need to see a provider. There are also higher rates of some of the most common causes of disease and also premature death, including higher rates of cancer. So in your experience in the chat, in your line of work, what impacts health in rural communities? What are you seeing where you are? Lack of transportation, stigma. We've definitely heard lack of transportation from a lot of partners as well. Poverty, tobacco control and a lack of cessation services, access to affordable healthcare, transportation, access, transportation, cost, reduction in availability. So not just the availability, but that it's being reduced. Transportation, there's closing of rural hospitals, distance, dental services, older populations, distance to care, quality care, access to specialty care. Yeah. Poor internet. Yeah. Access. Yeah. So these are definitely things that have come up in a lot of studies. We also hear these things from partners a lot when we go out and talk to them about the issues they're seeing as well. Access to social services in isolation as well. So we did see a lot of these transportation issues, internet, insurance. I don't know if it came up in the chat, but issues with insurance, lack of providers, environmental and occupational hazards didn't necessarily come up in the chat, but I think that those are other ones that folks often bring up during this class as well. Nurse professional shortage, yeah, yeah. Is there anything else that you think might be missing? I think we saw a lot in the chat, and then we've also seen a lot as it fits to some of these overarching themes. But is there anything else that folks think are important? Think anything else that folks think is important? Trust, lack of studies and trust issues. I think those things go hand in hand as well. So I'm going to move on to the next section, which is describe the current demographic trends in rural America. So we're really broken into two main parts. We're going to really talk about what is rural and what that sort of looks like overarching, and then we're going to talk about some of the resources that can help put into perspective or to gain more information about your communities or the communities that you serve. So first of all, what is rural? Um, so rural is actually defined in contrast to urban. So there's a definition for urban, um, and then anything that is not urban is considered rural. However, when I say there is a definition of urban, there is not um, one set, clear-cut, absolute definition of urban, therefore a clear-cut definition of rural. Um, You'll notice that there are no numbers like this is the cutoff point or anything like that on this slide. The big thing to be aware of is that there are two main federal definitions coming from the Office of Management and Budget, and then one coming from the Census Bureau. They are sort of the predominant if you are going for a grant or anything like that, looking at the cutoffs of what qualifies, you will probably definitely see one of these two. There may be some state, local ones as well. But in terms of federal definitions, these are the two big ones. There are different definitions, like I said, urban, rural, even looking at federal. The second takeaway, the definitions are not clear cut. So even when you do sort of see the actual cutoff numbers, and may include or exclude areas that don't always make sense. For example, the census definition is done at the census block/block group level and doesn't follow city or county boundaries. The OMB definition is done at the county level. So some areas that people might consider rural, if you live there, are in urban counties and not included. And then the third takeaway is that definitions are often the basis for cutoffs for programs and grants. So you really should be checking with whoever you're working with to see which definition they're using. And then when we get to the resources, looking at some of the data, visualizations, things like that, they will always say which definition or if they're using hybrid definition, anything like that. So the final thought on the definitions, the OMB definition means that 46 million people live in rural areas, which is about 15% of the population, the US population, but the census definition accounts for 66 million people, or just under 20%. So that's why there's this range that we keep mentioning, the 15 to 20% of Americans are considered rural. So I will get more into the economic research services of the USDA because they are an incredible resource for data sets, visualizations, all of those kinds of things. But one of the things that they do is put out every year a Rural America at a Glance. And so the 2025 edition, usually they come out in November. Usually there may be a delay this year, but we will look at the 2024 edition. And yeah, so we will be looking a little closer at the 2024 edition. Excuse me. So the 2024 report, Rural America at a Glance, focused on the age demographics of rural America and what that means both socially and then also economically and for the workforce. And so focuses on the age structure of the rural population and the implications of age-related demographic change through the lens of migration to rural areas, labor market participation, poverty, childcare and elder care, and also broadband. We did mention the internet access as an issue when we were sort of thinking about some of those things that come up. So some of the key takeaways, the rural population was concentrated among younger, so that under 15 and older, 65 years or older age groups. The growth of the 65 plus age cohort has been outpacing that of younger adults. So contributing to more older age counties where 20% or more is 65 plus. This growth has disproportionately been among rural counties, which on average have older populations than urban counties. And then a community's age structure influences demand for various kinds of goods and services and people's ability to balance work with caregiver responsibility. Rural elder care has grown over the last decade, but the industry hasn't kept up with growing older rural populations. This also is when we think about the workforce, the labor market in rural areas, we're also, they're seeing that divide. And then we're also seeing folks who are in the labor market who are also expected to be caregivers, both for children and for parents in those situations. So. One of the other things that has been seen with some information from the U.S. Census Bureau is that the growth is a growing racial diversity in rural America. And so these charts are from the University of New Hampshire Carsey School of Public Policy, which released a brief Growing Racial Diversity in Rural America Results from the 2020 Census. And I'm actually going to quote the report when we look at this. Nearly 1/3 of all rural children, so 32.5%, come from racial or ethnic minority populations compared to 28.1% in 2010. In contrast, 21.6% of the adult non-metropolitan population are members of a racial or ethnic minority. This growing child diversity is the result of two diverging trends. Over the past decade, the rural minority child population has grown by 229,000 or 7.4%, while the non-Hispanic white child population has declined by 980,000 or 12.7%. The contrasting patterns are in part because a larger share of the white population has aged beyond childbearing age. So then that's also what we were talking about before about the aging population as well. So This graph I also want to point out is from the Economic Research Services. Again, we will look at that later, but in specifically looking at this chart, looking at the intersection of poverty and race and ethnicity. This chart is the example of something that we will look at later, and the title of the chart is Poverty Rates by Select Racial and Ethnic Groups, and by residents. So meaning it's comparing metro versus non-metro across different racial and ethnic groups. And what the chart is showing is that there are higher rates of poverty in rural areas, that the gap for people of color is larger in rural areas. So there's also issues of rural health vulnerability. And so there are higher rates of underlying health problems in non-metro or rural areas versus the percent in metro areas. You have your aging population. You have the lacking health insurance. I think that came up in our conversation earlier about some of the issues that folks are seeing in their communities. And then distance to hospital with intensive care unit. That definitely one of those, the access and access distance, and then also transportation issues that we were talking about earlier. And this information came from the Rural America at a Glance 2020 edition. And so we can sort of see that information playing out even now as well. So somebody mentioned hospital closures in our conversation earlier about issues that they are seeing in their community. And so in 2022, they saw there was 136 rural hospitals closed. And some of the things that were cited for those closures included low reimbursement rates, staffing shortages, low patient volumes, regulatory barriers, and expenses for labor, drugs, supplies, and equipment. As we talked about earlier, that access to healthcare is an issue that has come up on multiple slides and again in our conversation. And so then one of the things that was done to try to address this issue was the Centers for Medicare and Medicaid Services introduced the idea of a rural emergency hospital model. So this is an emergency hospital only. The conversion meant that hospitals were getting rid of some of their inpatient and specialty care and focusing specifically on emergency and some ambulatory care only. So this model and this ability to convert to this model started in January 2023, and it keeps emergency departments open in rural communities. So one of the most recent studies from October 2024 of this model says that 32 hospitals in 14 states have converted. And to quote the report, the relatively rapid growth of the REH model has helped reduce the national rate of rural hospital closures from an average of 14 closures per year before the COVID-19 pandemic to 3 closures so far in 2024. So that was January to October 2024. Have any hospitals in your area switched, and do you have any thoughts on the model? One of the other things is that for hospitals that made the switch, they are able to bill Centers for Medicaid and Medicare at a higher rate as well. So that was part of the incentive structure for that. So we've been talking about some demographic trends in rural America. And then you also may need this information for program planning or grant writing. And I've mentioned USDA Economic Research Services. I want to mention right now the Rural Health Information Hub. And both of these things we will be looking at more in depth during the live demo. portion, but just to sort of introduce you to RAH Hub, the Health Information Hub, which is funded by the Federal Office of Rural Health Policy, has resources specifically looking at rural health information. So they bill themselves as your first stop for rural health information, and it's a great resource for exploring the topics that came up in the discussion earlier, things like transportation, broadband, lack of providers. So it takes a very broad view of health. So it's not just health conditions, but also the social determinants of health as well. Okay. So I'm gonna real quick introduce two resources that you can look at health conditions, and then we will transition to the live demo. So first I want to mention Medline Plus. Again, when we get to the live demo, which is coming shortly, this will be, we'll go through this more in depth. But Medline Plus is health information in plain language. It's designed for the general public, so patients, caregivers, if you just have a general interest in something and you want to look up that health information. It has a medical encyclopedia, health topics pages, and more that can give not only information on a particular health topic, disease, or condition, but also links to further reading both on the site and on other trusted sites. And then the CDC Rural Health. The CDC Rural Health page includes background information on the health needs and conditions of rural communities, as well as policy, success stories, and resources for addressing the unique health needs of rural communities. The CDC page, like most CDC pages, is geared a little bit more towards providers, but also has some really interesting information on policy and on policy and on interventions and things like that. Okay, so before I switch over to the demonstrations, any questions on the stuff that we've covered so far?
Nothing has come in yet, but people may be typing now, so we can give them. Oh, there we go. Okay. Oh, wait. Now somebody sent this to me. Okay. Which source would you recommend for identifying state-level physician shortages?
State level physician shortages. So there is a place in RH Hub that will give some local information as well. RH Hub and the USDA Economic Research Services both do state fact sheets as well. And so we can click through on those and look at those when we get there.
Great. So that's all that's come in at this moment.
Okay. So switching, oops. So we're going to start with the USDA Economic Research Services. So the USDA main page has some data on it. So like if you're looking around at things and you go to the USDA page, the U.S. Department of Agriculture, you can find some data, but that's mostly on crop reports and things like that. But if we're looking for health information or if we're looking for demographic information, we really want to be with the Economic Research Services. And so if we look at this main page, we can see that there is still some farm reports, outlook for different crop reports, things like that. But then we also get into things like charts of note, food access, some visualizations. The USDA oversees supplemental nutrition, so SNAP benefits, and so they are tracking things like food access and things like that. So we do have this data, explore all data, the fact sheet, and then again, some of the food pricing and some of the more information about crops and things like that. And then we also have their spotlight. So here we have the Rural America at a Glance that I mentioned earlier, as well as some of the other research and reports that they have out. And then finally, before I click into anything, I do want to mention Amber Waves is their newsletter, blog, things like that. So they do highlight different things there that may be of interest to folks. So I'm going to scroll up a little bit and go into the fact sheet since we did have a question about that. And so you can get overall summary, or so some of the demonstration later I'm going to be using some places in Maine. So if we want to look at consistent across, we can see what they have for Maine. So this is what, there we go, what comes up in this. So we have, population change and the total from census year up until 2023. Information about income, food security and insecurity, education, employment, farms as well, again, because this is the U.S. Department of Agriculture, more farm information, specific kinds of crops, things like that. But so that is the yeah. So that fact sheet isn't so much about health specifically, but if we're looking at the demographics and things like that, that's a good place to start. So if we go back to ERS and go back to some of the other things. So I'm going to go back to explore all data so we can see some of the filters that are there. Again, if you just sort of scroll down, you see that there's a lot of agriculture specific things, but if you filter by topic, you can find food and nutrition assistant, information, food choice and health, rural economy and population. So if we want to look at some of this information, so we talked a little bit about transportation in the what are some of the issues. There's also information about road ruggedness. So I think one of the issues was cars versus public transportation and all of that. But also if you're in a rural area and you have your road washed out, that's an issue. County level data sets, poverty area measures. So these are just some examples of some of the things that come up when you can filter for, let's filter again, rural economy and population. And so then under that, there's also other, uh, um, so like we could also look at poverty and well-being as another. Yeah. So then the Atlas of Rural and Small Town America is actually a really interesting resource as well. So you have your overview about the information, but it is actually mapped out. So you can see, so the population change rate. You can also select a map, jobs, unemployment rates, county classification, um, income, veterans. So if we're just looking, not to get too far into this, but if we look at the first map that comes up, we can also filter it just for non-metro. And so we can see some of the population change do that. My trackpad is being very sensitive right now. Okay. There we go. And then you can actually, again, zoom to state. So if we wanted to look at Maine again, can see that. So the white counties are our metro counties, since we excluded them, and then we can see the population change. And so we can see in Maine that there was minimal to no growth in some counties and then minimal growth in others. And then we can see in nearby New Hampshire that there was larger growth in one of their rural counties. So ERS also has some of their information visualized for folks. So they do have a public Tableau. The link is on that homepage, and it does everything, or there are examples of, again, food expenditures, as well as some of those crop reports, animal reports, but then they also do have visualizations for many of the different filters that we saw when we were looking at the data. So if we scroll down, we can see some of the information they have on food and nutrition assistance and food choices, markets. And then the rural economy and population that we were looking at. So it digs deeper into some of those other things we were looking at, including persistent poverty and high poverty in U.S. counties, and a retroactive consecutive decades of high poverty since 1960 in some of the counties as well.
Sarah, there's a question. I want to interrupt you here. Where was the public Tableau found?
Oh, yeah. So if we go back to the home page for ERS, it is under the data visualization. Yeah. So it's what is going on here? Yeah. So this data visualization link on the homepage gets to the public Tableau. The other thing that I want to mention is the charts of note. So they do pull out some of the charts they think that folks would find the most interesting. And again, they have similar filters, again, animal products, crops, etc. And if we scroll down, we get the rural economy and population charts as well. So if any of these catch folks' eye, we can see if anything looks interesting. Oh, we were talking about older populations. So we have the ratio again. So we can see that it's growing, elder care establishments, and the fact that it's not keeping pace with the growing, the aging population in rural areas. So that was a very quick, just sort of some of the things that are available on ERS. Before I move on to the Rural Health Information Hub, any questions about the economic research services from the USDA?
No new questions yet, but I will point out that we have a link to ERS on the handout, as well as that at a glance report is on there. Should be everything that we're touching today. So,
yeah. And I will say about this, this is just designed to be sort of here are some of the highlights. There's a lot of stuff going on, and it's an interesting one to sort of play with to see if you can to see what they think is important, what they've pulled out, but then also to sort of find things that you didn't necessarily think, oh, well, I didn't know that that was something that somebody had studied, or I didn't know there was this handy dandy chart with it. And then speaking of handy dandy charts, I will also say because these are federal government charts and data, they are Creative Commons. You can use them in things. You just have to make sure that you have the source. So at the end, at the bottom of this one, it says source USDA Economic Research Services, et cetera, et cetera. You can, use this like if you need it for a blog post or a grant or whatever, as long as you don't crop out that source information. So then I will move on. So I mentioned the Rural Health Information Hub, and they are, again, they build themselves as your first stop for rural health information. Again, they have information both at the national, state, and you can search some of it at the more local level. They also, again, take that broad view of health, not just disease, condition, things like that, but also social determinants of health. So that, excuse me, they do have good information about, um, access, broadband, things like that as well. And then they also have some the success stories and some, you know, the case studies, things that have worked in other places, things like that. So we are specifically talking first about some of the resources that you can use. So I want to start with, so on the top, it has the topics and states. So if we click into the state guides, you can see that there is just a list of states that you can click on, but then also some resources. So if you do need some assistance, if you have some questions about these resources, they have information that you can reach out to them for a little more in depth. And so I'm going to click on Maine again. And so you get the overview starting with information about how you can contact your state office of rural health. Interesting mapped information. Again, we see the same counties that we saw earlier in the light blue is metropolitan and the dark blue there. And so as you can see, when I hover, oops, Franklin County, um, you can get that level of information. So I also want to say when we talked earlier about, the definitions of rural and that where you look at the data, they should be telling you which one they're using. So we can clearly see that they are using the census data here. So then we can get an idea of the different kinds of hospitals and healthcare facilities that are available in Maine, and then also mapped out as well. And so, if I can take a closer look at that, make it easier to read as well. And then some social determinants of health. So again, we can see our aging population. So non-metro, metro, charts on education, poverty, trends, unemployment, and then you can get, specifically, so funding opportunities specifically for folks who are in Maine. And also organizations. So if you're looking for some partners, things like that. I'm going to scroll back up. And then the next thing that I wanted to show folks is this Am I Rural resource that they have. And so this uses various definitions of rural, and it looks at again, the various definitions, some of the categories that certain definitions of rurality might apply for in relation to grants and things like that. And so if I put in, so and hit locate. So this is Wilton, Maine. And so if I tell it to run the report, it will tell me that, this is where Wilton, Maine is. It's in Franklin County, sort of south or sort of central westish. Um, and then it'll break down some of the things. So based on this U.S. Census Bureau uh, classification, it is non-metro. Based on this other U.S. Census Bureau classification, is not urban. Federal Office of Rural Health Policy, Franklin County, Maine, has been designated as rural. So, when you are looking at, again, potential grants or partnership opportunities, and it's saying, oh, you have to be Federal Office of Rural Health Policy qualified or whatever. You don't have to know that off the top of your head. This tool can help you break down that. So, frontier and remote areas. This is not, so Franklin County, Maine is not a frontier or remote area, even though it is rural for all of these other things. And then, so some of the other program eligibility things. So for Center for Health for Medicare and Medicaid Services, yes, it is considered rural. Shorted designations for primary care, yes. Dental care, yes. Mental health services, no. Medically underserved area or population, this is a specific designation. It does not meet those qualifications. So that is another very useful resource here. The last thing I want to point out is the data visualizations. So you can Rural Data Explorer, charts, galleries, and maps. So again, the Rural Data Explorer has the drop-down menu. A lot of the classifications will come from if you look at a census or in the households. The more in-depth census households, you may be familiar with some of these things if you ever looked at a census report. And then also some other information about, access to healthcare. There was a question about doctor shortages. So we could look at doctors per 10,000 people, and we only want non-metro. And so we have, these. So the darker the color, the more people or the more doctors per 10,000 people. So we can see in our rural areas, they're getting that 0 to 15 in a lot of those places. And again, we can zoom in a little bit better. Oops. So then we see Maine again, Rasta County, and then some of the lighter colored. So then again, and then you can look at, this is what it looks more comparatively in chart form. Go back to this list, charts, and then again, maps are available as well. So again, just a real quick overview of some of the things that are available from the Rural Health Information Hub. Any questions on that before we move on?
Well, Sarah just sent a direct message. Is it possible to find state rankings of physician shortages? Um, well, I don't know
I
the answer to that, but I wonder if just using what you that where were you? The data, whatever, wherever you just were comparing years, that's still not going to be
so
rankings, but
I think we can so doctors per so I don't think this is exactly what folks are getting at, but we do have let's do there we go. So I just sorted the map. So from the Rural Data Visualization, Rural Data Explorer, I picked the filter for doctors, uh, so MDs per 10,000 people, um, most recent year. And actually, I'm going to turn that to non-metro and left the state selection as national. And then if you scroll down past the map, you have the average for the US. And then you have, and then I sorted by, so it comes up alphabetical, but you can sort it by um, the actual uh, thing that you're looking at, the actual filter you're looking at. So you can see, New Hampshire's doing pretty well statewide, Vermont, and then come down to the end of the list and see for the criteria for doctors per 10,000 people. Oklahoma is averaging about 6, Missouri about 7, Texas about 7. Um, so I don't think it's exactly what the person was looking for, but it does sort of put in some context um, for that. So moving on to the county health rankings, I will say that there is the ability to compare in this. So I'm going back to, we looked at Wilton, Maine, which is in Franklin County. So I'm going to use that as my search criteria. So right off the bat, they tell me that Franklin is rural and that it's 100% based on the criteria that they're using. The entire county is considered rural. You can do your demographic information and then the county snapshot. Um, so you can see that it is, Franklin County is somewhat average, slightly below average for the state, slightly above average um, for the national average. Um, these dots are the other counties in Maine. So this is actually comparative right off the bat. Um, and then you can dig into the more specific information. And they have some interesting, or it compares right off the bat. So Franklin County versus Maine versus the US. And so looking at this, you can see it's higher. And so you can actually click and it'll give you more information about that, including graphs, tables, and downloadable graphs. So you can see this was the premature death category. You can see the trends with the United States trending uh, sort of up through COVID and then sort of leveling off. Maine sort of somewhat level, trending up during COVID, and then Franklin County trending up higher than that. So, and then you can see some of the leading causes of death for Franklin County, poor physical health, birth weight, all of that. So again, you can click on any of, so if you are looking at specifically, if you want mental health information, you can click on that and get a little bit more information. There's not as much as the premature death. And it does caution because of the margin of error on this one specifically. But then we were also talking about with the RIH Hub, they are looking not just at diseases and conditions, but then also community conditions. So social determinants of health. You can do areas to explore if you just want areas of strength, or you can go and sort of look at some of the things that are going on. Physical environments, air pollution is one of the ones that Maine looks pretty good on, and then Franklin County as well. Broadband, we talked about broadband earlier. They are not just below the national average, but they are also below uh, the rest of, or the average for the state of Maine. Um, things like that. So then you can also compare it and it will build a table for you. You can only compare within the state. So like I can't look at Franklin County, Maine and a county elsewhere, but I can build a table that will allow me to look at, so Franklin County, and then I can add a location. Um, and so let's see if I do this right. Um, Penobscot County, uh, you can see it's very similar in a lot of ways. And then I could also add back in Maine as a whole as another uh, point of comparison, and then I could add back in the United States as another point of comparison. So you can build your own chart as well to compare the data, various data points to other places in the state as well. So. Any questions about the community health rankings and roadmaps?
Nothing has been typed in at this
Okay.
point.
So since there's one more demonstration and we are getting a little closer to 3 o'clock than I would like, I will move on to Medline Plus is health information in plain language. So it really is designed for you, me, anybody to use as a way both to get information, but then also a way to do research with trusted sources. So there are a couple of different ways to search Medline Plus. There's the sort of standard search bar at the top. So if I start to type in rural, it'll give me some suggestions on things. So if I do rural health concerns, it gives me results which tell me that there is a page on Medline Plus specifically. So here's some overview information. It gives me links that are very clearly labeled. So National Library of Medicine, Rural Health Information Hub, NIH. Then it also includes the little NIH logo on that. It also allows you to filter. So if you just want a health topics page, this topic doesn't have a medical encyclopedia entry. If you just want external links, if you just want information about drugs and supplements, on that way. So if we click into the health information page, they all look the same. So you can kind of start to be able to if you just want to start with the summary, there's a start here, which will link out to other resources. If you just want to start with prevention and risk factors, this top acts almost as an index to let you know what's on the page, but also to allow you to jump to whatever you need. So we have our summary, and then we also have linked words and concepts. So if you want more information about that, or if you come across a term that you're not familiar with, you can use that to jump to that page as well. And then again, the links that go out to other resources are clearly labeled to where they go. And it allows you, again, to start with some background information, but then also know that the links that you are following are taking you to credible sources as well. I'm going to scroll back up and mention that Medline Plus is also available in Spanish. All pages have the Espanol button at the top, and so you can actually just switch between at any point if that's resource and information that you need as well. And so then you can kind of see that it has the same format. It has some of the same things linked. It has the same related terms on the right-hand side. So I'm going to switch back to English. And then I am going to So hypertension is on this page as a concern in the list in the summary at the top. So I'm going to just do this real quick so that you can sort of see, what the search looks like. It brings up the same information, again, the same filters. But one of the reasons I wanted to click into this page is to show you that with some of the things, there is additional information on that right-hand side. So in the rural health one, it was just the related health topics. But if there are related medical encyclopedia articles, that will also be listed on the right-hand side as well. We are more or less at the end of our hour.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel or select a video thumbnail to watch another video from the channel.